今天咱们接着讲，咱们常见病就是经方治疗肺炎啊。
So we'll continue the webinars with diseases very commonly seen and very effective with Jing Fang, nephritis.
所以对于肺炎的基本知识，我们前边讲了，它是属于免疫病的，因为免疫病我们讲了，干燥综合征，红斑狼疮，白菜氏综合征，这些病它太多了，我们没一起讲，是单独的把这个肾炎的分出来一块，今天咱们一块讨论。
So Jing Fang is very effective for immunity disorders. Last webinar we spoke of Behçet syndrome, Sjögren's disease, and this time we'll continue with nephritis. Since nephritis is more complex and there's very, very good results with Jing Fang, however there are many different patterns, so we took a different day to focus on nephritis.
肺炎有多种，常见的有急性肾小球肾炎，还有慢性肾小球肾炎，还有过敏性肾炎、自荐性肾，就是说囊疮性肾炎。我们上一次讲课都讲过了，所以都是免疫性跟免疫性疾病有关的啊。
So there's many different kinds of nephritis. There's acute nephritis, chronic nephritis that could affect either young patients or elderly patients. There's also allergic purpura nephritis and lupus nephritis that we discussed last webinar.
这些病吧，病因病理不同啊，所以分开讲。但有共同地方就是跟免疫有关系啊。
So these diseases will present themselves with different types of symptoms, and so we'll represent different patterns in Jing Fang. So we'll go through one by one.
第二个，我们讲一讲经方医学的特点。
Okay, so let's review a bit the specialty of the Six Syndrome medical system.
第一个特点是经方是辩证，它是个辩证论治的。六经辩证论治。
And so of course we'll be analyzing these diseases through the Sixth Syndrome.
所以经方就是它就是个医学体系，什么特点呢？是以八纲六经方正理论治病的医学体系。
And so even though we're going to review very severe cases, we still need to go back to the classics and go back to the 8 guiding principles and Sixth Syndrome analysis.
它在临床治病就是先辨六经，具辨方正，求得就是做到方正对应治愈疾病。
And then after we've correctly identified the Sixth Syndrome or the syndromes that are affected, target the formula pattern and modify the ingredients and the dosages of the ingredients to fit the case.
它是有别于内经啊，《黄帝内经》的医学体系，它的代表著作就是《伤寒论》啊。经方的主要理论是六经辩证理论啊，所以它那个理论的实质，六经的实质是跟内经是不一样的，完全不一样的。
And so we review again that it's the concepts and the approach is completely different from the Neijing approach.
所以这个胡一树先生通过医生的研究，认为《伤寒论》的六经是六经来自八纲啊。
So again, we reviewed paying homage to Professor Hu and remind us that he's the one that clearly spent a lifetime of analyzing the Sixth Syndrome according to the 8 guiding principles.
而内经，《黄帝内经》的六经是什么？是经络脏腑的概念啊。
Which is different from the meridian channels.
第二个特点，经方理论、经方医学的第二个特点是辩证主要依据症状反应。
So the other specialty of the Jing Fang medical approach or medical system is always analyzing the symptoms and the changing symptoms.
它治病不是辨病论治，而是辨证论治。依八纲辨证，先辨六经，即辨方正，有是证，用是方，求得方正对应治愈疾病。
So it has nothing to do with the actual name of the disease that the patient will present you, but the symptoms that they will share with you.
而现在流行的释方派，它就是辨病论治
which is very different from the TCM aspect where they use the name of the disease. For example, you have a cold, well, you take this medicine for cold. You have bronchitis, you take this medicine for bronchitis.
他们是以辨病因为主。
Or it has nothing to do either with the cause of the disease. So it's not lung deficiency or kidney deficiency or whatnot. It's to do with the sick syndrome.
第三个我们讲经方治疗概况，就是治疗肾炎的概况
Okay, so let's move on into different clauses that are targeting the symptoms of nephritis. On your PPT, it will be on page 8. So I know you have a PDF, but you can count the PPT. There's page numbers.
所以肾炎这个在古代中医里头没有肾炎这个名字，这个病名。
So there's, like we mentioned, there's no terminology that exactly says nephritis in the classics.
但是根据症状反应我们可以知道，经方在古代已经积累了治疗肾炎的经验。
So, however, we can analyze the classes according to the symptom presentation.
第一个常见的方证，在肾炎经常用到的一个方证是什么？月比汤方证。
And so we'll start with the one that's most oftenly used in clinic, 月比汤 formula.
这里举的一个病例就是一个男的63岁的，是1965年7月6日胡锡柱先生治疗的一个病例。
And so this is a case treated by Professor Hu in 65, Mr. Tong, 63 years old.
所以这个病例是什么？慢性肾炎，诊断的是慢性肾炎，在某一个医院治疗3个月，效果不明显。尿蛋白波动在1个加号到3个加号没办法来找中医治疗。
And so this case, the patient had gone through many different kinds of hospital and many different kinds of treatments, however, was very unsuccessful, and his urinary protein level went from 1+ to 3+.
他来的时候症状是什么样呢？四肢及颜面都肿皮肤灰黑，这是那个色素沉着了都有的。腹大气平，就是肚脐都有，还没肚出来已经被压出来平了皮肤了。吃饭不好，小便量少，汗出不汗，舌苔白腻，脉沉细。
And so the accompanying symptoms are swelling of the forelimbs and the face. There was a very dark grayish complexion. There was a flat abdominal area, low appetite, very scanty urine, sweating without an aversion to cold, and a white greasy tongue coating, and a thin deep pulse.
所以我们经方治疗什么的？先辨六经，六经辨是什么？太阳阳明合并。
And if we look at the symptoms, we can see that it's a Taiyang Yangming concurrent pattern. 能不能分析说帮他们说哪一个是太阳，哪一个是阳明？
太阳就是这个，就是说四肢肿这个肿就是表现在这个有水是吧？但是也有表，它有汗出不汗。说明这个汗出一方面是表，还有里热所以这个有表也有 也有离啊，所以这个造成的这个就是外泄离，这个肿啊，本身就是个外泄离，饮酒化热以后，热比津液外出，所以出现了汗出不恶风，不恶寒。
那这里能说是太阳太阴阳明合并吗？
因为他这个呼吸术变的，主要是他认为他是个
月比汤
外太阳阳明合并。
Okay, so I asked Dr. Fang to look at the symptoms and analyze it a bit deeper for us. Here, the sweating without aversion to wind is both an external. The sweating, of course, we know is external. However, there's no aversion to cold, and so this shows that the internal heat is very pronounced and is causing the sweating without aversion to cold. And this swelling of the whole body of the face and limb is also shows an exterior syndrome. And since Professor Hu prescribed Yabitang to this patient with success, then this shows that it's a Taiyang Yangming concurrent pattern. Also, there is also Taiyin, but since the internal rooms have transformed into heat, causing the dark complexion, causing the sweating without aversion to cold, the scant urination, so all these are signs of heat, and so the Yangming is more pronounced than the Taiyin.
因为它这个有个纳差，完全可以。有那个太阴的可能，因为有水啊，到一般的水也可能有太阴，但是呼吸术当时辩证了，他没考虑到太阴，他因为这个水肿啊，非常的四肢面目都肿，所以这是有表里合并的风水啊，就是说外泄离隐症，所以他主要辩证为他是治他的太阳阳明合并。
So he says, looking at the symptoms, we can see that, of course, there is the presence of a Taiyin syndrome, since there's low appetite, there's a greasy tongue coating, and the edema shows a clear internal room retention. However, the room retention was more on the surface, and so will be treated as a Taiyang syndrome in this case. And the Taiyin was also less pronounced than the Yangming, and that's why it wasn't directly targeted in the first treatment approach.
一会儿下边我们分析一下这个跟慢性石甘汤有点近似的，就是也是外泄离热的是对比一下。
And so later on we'll compare again with Yebitang with Mashing Shigantang formula, since they're both external water retention with internal heat concurrent pattern.
所以这个他吃了结果吃了一剂小便是增多，说明是对症了，吃饭也好了，他这有纳差嘛，所以你说有太阴的也有，但是他把那个外邪通过发汗去了外邪，去了离隐以后，人体就恢复了，这个隐去了以后，他这个隐是正常了啊。
So after taking one dose of the formula, the urine output increased. So we knew that Dr. Hu knew that this was the correct formula, and so recommended the patient to take 20 more doses of the formula. And by increasing the urine output, the appetite also changed. So by treating the exterior syndrome and removing the water retention on the exterior layer, also helped remove the Taiyin syndrome.
继续服了20剂，腹水都消掉了，而且茶蛋白阴性，尿的蛋白变成了阴性，痊愈出院了。
And so after 20 more doses of the same formula, the urine protein reduced to a negative statement, and there was no more swelling of the body.
所以我们结合着刚才我们提的问题来讨论一下所以这个病为什么这样治呢？是有根据的，是古人给我们留下来的经验所以《金匮要略水气病》就提出了风水恶风一身细肿，脉浮不可，细自汗出无大热，约比汤主之。
And so he says if we discuss about this case, he said, why would we take half exterior, half interior formula for such a chronic case of nephritis? He says, well, we can look again on clause 21 that we saw earlier, where it says wind water, aversion to wind, edema of the body, a floating pulse, no thirst, incessant sweating with excessive heat, 约必汤 governs.
所以外邪内淫出现水肿，称作风水恶风脉浮为外邪，一身细肿为水气，细自汗出无大热，这个与麻杏石甘汤症汗出无大热意思相同啊。
So, however, this is very similar, as we mentioned, with Maxing Shigantang pattern, since this is a full body edema with symptoms of continuous sweating and excessive heat. So the similars are very similar.
所以这个它虽然有汗出，但是津液没有伤到这个明显的吸水，所以故不出现口渴。
The difference is that in both cases there's excessive sweating. However, in Yue Bi Tang, there is not such a severe deficiency of body fluid, and so we won't see the symptom of thirst.
这个麻杏石甘汤，它是汗出无大热就是说至于什么，它这个外边的热不厉害，但是里热有，所以里热比津液外出现了出汗多所以它是有表有里热，所以太阳阳明合并，这一点是跟月比加入汤是一样的。
So in both Maxing Shigantang and Yuebi Jiazutang, there's both an exterior water wind accumulation, so edema on the exterior layer, with an internal heat retention.
所以但是月比汤有生姜大枣这个麻杏石甘汤没有这个生姜大枣所以它麻杏石甘汤治疗治水，它就不入这个月比汤能治水因为它有生姜大枣兼中和味嘛
So another way to remember the difference between these two formulas is that Yuebi Jiazutang or Yuebi Tang has Shenjiang and Dazao, which fortify the middle and is more effective to eliminate water. So by fortifying the middle, the body is stronger and promotes the urination more effectively than Maxing Shigantang.
所以这个病，我们可能后世一些人可能用月比加猪所以胡锡寿先生没加猪，所以他就是因为他有这个经验，这个月比汤里头有生姜和大枣，在这里头兼中和味，它也这样使这个水气通过兼中和味以后，那个使水气去
And so he says if we see this patient today, we might give him the formula Yuebi Jiazutang to eliminate the tai in the internal room. However, Professor Hu had this experience that only putting Shenjiang and Dazao would be enough for this patient to eliminate internal room.
所以对于风水的认识，吉贵要略还有一条就是风水气脉自属，外症骨节通通恶风，还有这个症状的特点。
And so in the Jing Yalue on the wind water diseases, it says wind water pulse is floating with external pattern manifestation and stabbing pain in the bones and joints, as well as aversion to wind.
所以这一条说的细自汗出这个所以出了汗以后，这骨节就不疼了所以用这个月比汤治疗。
And so in this case, we'll also be using Yuebi Tang to remove internal room and also treat the pain in the joints.
如果不出汗呢，湿在里头，在关节里头、肌肉里头，所以就疼，而且有些有积了热吧，造成了有烦疼所以这个时候就用属于大青龙汤症了。
However, if there's no sweating on the exterior, so there's no exterior layer, but there's pain in the joint with vexation, then there's a presence of the internal layer, and so we'll be treating it with 大青龙汤。
这要说明一下什么？这个水气代表是用发汗的办法啊，在津液稀碎的时候不可发汗，所以在经过药的水疾病篇有咳而下痢，小便竖着，不可能发汗啊，这么一个告诫。
So of course we learned in the exterior webinar that when there's an exterior layer disease or syndrome, we need to promote sweating. However, this is contraindicated in the case where there's body fluid deficiency or complete depletion, and so in that case we'll need to nourish the interior to produce body fluids.
所以脉浮不咳正是本方发汗的关键依据啊。
哪一个？
就是咱这讲这个月碧加注汤，月碧汤啊。脉浮不咳，月碧汤是脉浮不咳的。
And so two symptoms that directly point to 月碧汤 is floating pulse with no thirst.
这后世的一些注家认为啊，这月碧汤里有生石膏啊，所以有生石膏认为是有渴，所以把这个脉浮不渴改成脉浮而渴。
So later on, in the original clauses it says floating pulse with no thirst. However, since in the formula there is shenshigao and that treats thirst, later on the experts changed it to floating pulse with thirst.
这是胡锡树先生提出，这是大错的，不对的。
And so Professor Hu always reminded them that it was a big mistake.
所以石膏所能够去的热是什么？不一定是渴，有热的用生石膏不一定是渴。
And even though shenshigao is able to remove internal heat, it doesn't automatically treat thirst.
用生石膏什么时候用啊？口舌干燥可以，再一个主要是烦躁就用它就行。
And shenshigao is very good to eliminate heat when there's symptoms of vexation.
所以要是真的大咳湿饮啊，想喝水啊，这是津液大伤的主要是依据啊。这用生石膏不行了，必须用什么？用人参才能有效啊。
And so when we have symptoms of severe thirst with a desire to drink, this is a sign that the body fluids are very severely damaged. And to be able to promote body fluid in this case, we need to tonify the zenqi with rensheng, with ginseng.
有时间我们可以看看《伤寒论》和《金匮要略》里头的关于生石膏有3条嘛，生石膏3条，白胡加人参6条啊，这个可以看一看，对比一下。这个白胡汤的3条都是用生石膏嘛，一个也没有渴。6条，白胡加人参，条一条有口渴。
So there are 3 clauses. He says to prove this, there's 3 clauses in the Shanhan that discuss Bai Hu Tang, and in every one of these 3 clauses there's no presence of the symptom of thirst. However, there's 6 clauses that discuss Bai Hu Jia Renshen Tang, so Bai Hu plus Renshen, and each one of the 6 clauses of this formula also has the symptom of thirst.
所以这个月碧汤和月碧加注汤用生石膏，不是说因为有渴啊，而是有烦有舌干就可以啊。
And so this also confirms that Yuebi Tang doesn't treat thirst, it treats internal heat causing vexation. And that's why we have the presence of Shen Shigao